Today I'm going to talk to you about central venous catheters. A central venous catheter is a special kind of IV. It is a small tube, like a straw, placed in a vein to give someone fluids or medicine. A central venous catheter, or central line, can stay in place for weeks and even months. A central line will allow your child to receive IV fluids, nutrition, medicines like antibiotics or chemotherapy that can hurt smaller veins. A central line can also be used to collect blood for tests. This is an implanted central line, or portacath. You will hear this called a port by the nurses. This end of the port will be placed under your child's skin, in the chest or belly, and held in place with stitches. The tube end will then be placed into a large vein near the heart. A port is different from other central lines because you can't see it. You will only see or feel a bump under your child's skin. To use a port, a special needle will be placed through your child's skin and into the port. This video will teach you how to care for your child's port at home, how to access a port, and how to flush and give medicine through the port. We want you to feel comfortable taking care of your child's port. Your port booklet is for you to take home so you can refer to it whenever you need to. Take the time while you and your child are in the hospital to learn about the skills we discussed. You may want to practice how to put the port needle in place and also how to remove it. The best way to feel comfortable with these skills is to do them as much as possible while your child is in the hospital. When the needle is in the port for medicine or fluid, we call this accessed. Whenever the port is accessed, it will have a special dressing over the area. When the needle is not in place, we call this deaccessed, and there is no dressing. Once you arrive home, talk with your home health nurse to find out what you can expect from them. Your home care company or pharmacy will give you all the supplies you need, though they may look slightly different from what was used in the hospital. When you do port care, make sure the area where you work is clean. Do not do port care in the bathroom because there are a lot of germs in the bathroom. If you're going to access or deaccess the port, have your child lean back on a couch or in a chair. Place a clean towel under your child. A kitchen counter or table is a good place to put the supplies you will be using. Before you begin port care, clean the area you will be working in. Use an all-purpose cleaner for hard surfaces. Place a clean towel on the surface after you have cleaned it. Gather all the supplies you need and place them on the clean towel. Make sure the supplies are in a location that is easy to reach while you are doing care. Look at the port site and make sure the dressing is clean, dry, and sealed to the skin when the port needle is in place. When the dressing is sealed to the skin, it helps keep germs out. Before you start, gather your supplies: dressing change kit, port needle with tubing, normal saline syringe, 10-unit heparin syringe, needleless connector, disinfectant cap if you have them, and steri strips. Wash or sanitize your hands. Get the needle ready to use. Open the dressing change kit. Look at the skin where the port is and make sure there are no signs of infection. If your kit has a mask in it, put it on. Put on the sterile gloves from the kit. Once you have on the sterile gloves, only touch the supplies you will use to access the port. Connect the needleless connector to the end of the port needle tubing. Leave the plastic cover on the port needle. Remove the cap on a normal saline syringe and attach it to the needleless connector. Push enough fluid from the normal saline syringe into the tubing to get a few drips out of the needle. Leave the syringe attached. Place on a sterile or clean surface. Clean with chlorhexidine, also called CHG. Take the CHG and squeeze the wings. This will break the liquid container and wet the sponge. Press the sponge lightly over the port site until you see liquid on the skin. Clean the skin around the site with a CHG sponge for 30 seconds. Scrub in many different directions. Clean all the areas that will be covered by the dressing. Allow the skin to dry all the way. This may take 1 or 2 minutes. Do not wipe away the CHG, blow on, or fan the site. Apply skin protectant if available. Put the protectant on the skin in a picture frame shape where the dressing will be. Leave a 1-inch space around the insertion site where you do not apply protectant. Let the protectant dry all the way. This may take 1 to 2 minutes. This will keep the skin from getting irritated and allow the dressing to stick better. Take the plastic covering off the needle. With a sterile gloved hand, feel the port's bump under the skin. Place your fingers on the sides of the port to keep it from moving around. Insert the needle straight into the skin. Push the needle into the skin until you feel it touch the back of the port. The port is now accessed. Secure the needle with 2 to 3 steri strips marking an X over the needle. Using the hand that pushed the needle in, gently pull back on the syringe until you see blood in the tubing. Blood in the tubing means the needle is in the right place. Once you see blood, gently push on the saline syringe. The blood and saline in the syringe will go back into the port. Clamp the tubing and then remove the syringe. Remove the cap on a 10-unit heparin syringe. Attach the syringe to the needleless connector and unclamp the tubing. Gently push the heparin into the port. Clamp the tubing and remove the syringe. Place a new sterile dressing over the needle. Secure the tubing with a piece of tape. Place a new disinfectant cap on the needleless connector if you have them. Write the date and time on the label and place it on the port tubing. Every 7 days while your child is using the port, you will need to remove the dressing and change the port needle. Before you start, gather your supplies. 10 milliliter syringe with 5 milliliters of 100 units per milliliter of heparin, alcohol pad, procedure gloves, new disinfectant cap, and gauze. If you're replacing the needle, gather the additional supplies you will need. If you are not replacing the needle, you may need a small bandage. Wash or sanitize your hands, and put on procedure gloves. Clean the end of the needleless connector with an alcohol pad or remove the disinfectant cap. Remove the cap on a 100-unit heparin syringe. Attach the syringe to the needleless connector and unclamp the tubing. Gently push the heparin into the port. Clamp the tubing. Remove the dressing carefully. Gently pull the safety needle straight up and out of the skin until the needle clicks and locks in place. Then lift off the rest of the port access device. If the site bleeds, gently apply pressure until the bleeding stops. If you're going to re-access the port, clean the skin and access the port as already discussed. If you are not replacing the needle, place a small bandage over the site if needed. Heparin is a medicine that thins the blood. A small amount of heparin in the catheter will keep the catheter free from blood clots. This is called a heparin lock. It is important to keep the port free from clots so it will work properly. Normal saline is used to flush the port before and after medicine is given using the port. This will ensure the catheter does not have medicine left in it before and after each use. Flush the catheter with heparin every 12 hours when you are not using the port. If your child is receiving medicines, you will be flushing the catheter before and after each medicine. Before you start, gather your supplies: alcohol pad or a disinfectant cap, heparin flush syringe, procedure gloves if you have them, wash or sanitize your hands. If you have procedure gloves, put them on. With an alcohol pad, scrub the end of the needleless connector very quickly in a back and forth motion for 15 seconds. Let the alcohol dry for 15 seconds. If your child's port has a disinfectant cap, remove it and throw it away. Remove the cap on the heparin syringe. Make sure there are no air bubbles in the syringe. Attach the heparin syringe to the needleless connector. Unclamp the catheter. Gently push the heparin into the port. If you notice any air in the syringe, stop before you push any air into the line. Clamp the catheter. Remove the syringe. Place a new disinfectant cap on the needleless connector if you have them. Your child's doctor may order medicines to be given through the port. The medicine pump you have at home will be different than the ones at the hospital. Your home care company will teach you how to use the pump. The medicines you give at home may have a different concentration than at the hospital, so the medicine may run faster or slower. Make sure you follow the instructions from your home care nurse. Before you start, gather your supplies: normal saline syringe, heparin syringe, medicine syringe and tubing, alcohol pad or disinfectant cap, procedure gloves if you have them, wash or sanitize your hands. If you have procedure gloves, put them on. Scrub the needleless connector with an alcohol swab for 15 seconds. And let dry for 15 seconds. Or remove the disinfectant cap and throw it away. Remove the cap on a normal saline syringe and attach it to the needleless connector. Unclamp the catheter. Gently pull back on the syringe. You should get a small amount of blood into the syringe. If you can't get blood return, contact your child's doctor. Gently push 10 milliliters of normal saline into the port. Clamp the catheter again and remove the normal saline syringe. Remove any caps that may be on the medicine syringe or tubing and attach the medicine syringe or medicine tubing to the needleless connector. Unclamp the catheter. Give the medicine as directed by your pharmacist or home care nurse. Once the medicine is done, clamp the catheter and remove the medicine syringe or medicine tubing. Remove the cap on a normal saline syringe and attach it to the needleless connector. Gently push 10 milliliters of normal saline into the port and remove the syringe. Remove the cap on a heparin syringe. Gently push 3 to 5 milliliters of 10 units per milliliter heparin into the port and remove the syringe. Place a new disinfectant cap on the needleless connector if you have them. Thank you for taking the time to watch this video. We encourage you to take an active role in caring for your child's port. The more you practice these skills here at the hospital, the more confident you will feel in caring for your child's port at home.